Hello, my name is Ken Morehead, and I'll be doing a presentation on strategies for treating common cold and the flu at home. These are standard points that we'll be using. We'll talk about locations, we'll talk about methods of treatment, and these are designed to help you have more comfort while you're feeling poorly and also recover more quickly. So this process plays out. You support your immune function and your lymphatic circulation so you can get well more quickly. And let's dive in. I'm going to share my screen now. All right. So common cold and the flu, practical home care strategies. Our agenda will be, how do you support your immune system at home? Points and locations for general immune support, lung pathology, headaches, sinus infections. We'll talk about helpful tools toward the end, how to use a neti pot, and we'll wrap up, and I think we'll be in good shape. You'll have a lot of tools that will be helpful for you. Prevention is first. The four most important lifestyle factors that affect immune function positively are sleep, nutrition, exercise, and relationships. Now, here's the thing. We all know these things. And it's also easy to kind of stop paying attention to one or two or all four. And this is a gentle reminder that, you know, if we haven't been paying attention to sleep and getting adequate sleep, that's a big deal, plays a huge role in viral resistance and immune function as a whole. Nutrition, as you all know, if you're OHS patients, nutrition's a big deal. We really pay a lot of attention to nutrition at OHS. It's a major player. So if things are sliding and you've been eating more processed food lately or rancid vegetable oils like canola oil or eating more sugar, okay, get back on track. It's a gentle reminder to be aware of these things. Anything specific relative to nutrition for you as an individual, that's really between you and your practitioner, those specifics, but the broad brushstrokes are true for everybody. You know, organic food, high quality food, avoiding simple carbohydrates, rancid fats, all those things apply. Exercise is an enormous factor in maintaining brain function, good circulation, blood production, and helping to maintain a good immune system. And what's interesting that most people don't realize is that exercising, really strenuously, while we might be sore afterwards, so there's a short-term inflammatory response, there's a much more significant long-term reduction in inflammation from strenuous exercise. We're talking, aerobic exercise, weight training, the whole variety is a really great way to strengthen our bodies as a whole. And the immune system is part of that. Relationships is another area that we don't typically think about. Oh, yes, I haven't been feeling like I'm getting sore throats. I'm not like I'm on the edge of getting sick. And we don't necessarily think that relationships are an important area for maintenance, to be aware of that. Relationships, as we all know, are incredibly complex, and they take attention, and there's effort involved. And if we just kind of let them slide and there's an area of friction in our lives in a relationship, that's going to undermine immune function. So this is another just gentle reminder. Keep these in mind. If there's a relationship that needs some attention, let's get the communication skills out and do what we need to maintain these so that they're functioning well. Otherwise, that's going to be a drain on immune function. Early infectious stage marked by upper back chills, headache, heavy head, and sore throat. If you notice the sore throat first, then of course that's your first signal. But if you notice the other three first, that can actually be even earlier stage than sore throat. So anyway, if you notice any of these, let's get on some of these points. So the style we practice at Oriental Health Solutions is the style that's been taught in the world internationally by Kiko Matsumoto. It's a late 20th century Japanese style. And there are 7 points that are called the 7 tonsillar points. So they're supporting and regulating immune function. And these are useful at any time during the infectious process. So we're going to go over all these points so you know how to find them. The first point is Master Nagano's immune point. And the way I like to find this is if you have your forearm in this position and you bring your other hand toward your forearm and wrap your thumb around the top where you see the illustrations here, your thumb will find these points. And there's probably going to be one that's really tender, maybe only one, maybe two, maybe three. Wherever you find tenderness, that's the place to work. You found your point. So don't stress about perfection here, just play. Look for the point, palpate, see what you get. You're going to find something tender, great. Use that. That point is going to be active and you'll get impact from treating it. This point responds really well to treatment with the Tiger Thermi Warmer or shiatsu, which is finger pressure, or with an incense stick. A lot of different ways to treat this point. And again, we'll talk about all these approaches later. When we get cold or flu, most of us will get that tight, stiff, achy low back. And this immune point works great to help clear some of that discomfort so you can rest more effectively. Governing vessel 14. In the space between the 7th posterior cervical vertebrae, there's a spinous process there that sticks out. You can feel the bump. And the first thoracic vertebrae, if you move your head forward like this, way forward, the cervicals will move and the thoracic vertebrae won't because it's stabilized by the rib cage. So if your head moves forward, you're going to feel this space open between the 7th cervical and the first thoracic. If you're back there palpating, put your hand back, you'll feel this big gap. That's governing vessel 14. Now, it may be sensitive right there in between those spinous processes, or it may be more tender just to the right or just to the left, or the whole area. Wherever it's tender, that's where you're going to work. Triple Warmer 16, if you're not feeling, if you feel fine right now, you may feel nothing back here. But if you're feeling on the edge, or you're getting a sinus infection, or you've got allergies, or you have a cold or the flu, it's typical for the lymph nodes in the posterior aspect of this muscle, the sternocleidomastoid muscle, to be tight and tender. So when you palpate back here, again, you're looking for the tight, tender areas. What you find, that's the treatment area. This particularly responds well to treatment with the Tiger Thermi Warmer. Kidney 6, right below the medial ankle bone, the inside ankle bone, and you'll actually feel that there's some tendons right below, and just in front of them, there's a little depression beneath the ankle bone, and that's where kidney 6 is located. Responds well to shiatsu with finger pressure, an incense stick, Tiger Thermi Warmer, they all work well. Now, locating stomach 45, if you have my hand represent your foot, so thumb would be the first toe, the big toe, finger is the second toe. So on the second toe, on the border of the nail, so the proximal or the nail that's close to you, that border, if you draw a line there, and then if you draw a line on the border of the nail that is closest to the little toe, the 5th toe, where those two lines intersect, that is stomach 45. And it's just anatomical. You draw the lines where they intersect, that's stomach 45. Responds really well to treatment with an incense stick, that little teeny ember, because it's a teeny point, works great. If you're using finger pressure, you're probably going to need a fingernail, because again, it's such a tiny point. And you'll use your fingernail to find the exact spot where it's a little bit tender, and that's stomach 45. 44 is between the margin of this, where you feel the web margin, and the knuckles on the toe. Halfway in between, that's where stomach 44 is located. Inflammation in the lungs. In the illustration here, you'll see lung 5 and lung 9. Lung 5 is most often a little distant from the crease, a little away from you toward your hand, but along that same line. And again, you're going to palpate, push around, find out where it's tender, that's the spot you're going to work. Lung 9 is on the wrist crease in this depression, right where it's illustrated. That's the point you're going to work. These respond to tigerthermy, incense stick, and finger pressure as well. Inflammation in the lungs. Kori is Japanese for oxygen deprivation. And so if we're feeling your lungs are tight or constricted, or even if you have something completely unrelated to cold and flu, if you have, say, Raynaud's syndrome, which is a reduction of circulation in a specific forearm or shin, this is great for supporting circulation of oxygen and access systemically. It's magic how well this works. And you can get your hand back there and palpate medial or medial to the scapula on both sides, and you'll find areas that are particularly tender or tight. This is great to massage on your own, but to treat it with heat, with the moxie, you're really going to need a tigerthermy to do that, and somebody else is going to have to treat this point in that case. So just be aware that this is a great point to use for that. Now, also for lungs, on the backside, we talked about DO14, governing vessel 14, and that space between the 7th and cervical and the 1st thoracic vertebrae. If you put your finger in that space and then you go over that bump, the 1st thoracic spinous process, into the next depression, and then do that again into the 2nd depression, and again into the 3rd little empty space beneath the vertebrae. That 3rd space is the 3rd thoracic vertebral area, and that's a major area for lung reflex in the back. And again, it might be right there beneath the spinous process, the 3rd thoracic, or it might be just to the right or just to the left, wherever it's tender. Someone else get in there with the tigerthermy. Oh, it's heavenly. You'll feel so much better. Now moving on to headaches. Behind the eye headaches, vertex headaches, that's the top of the head, temple headaches on the side, frontal headaches, sinus headaches, and occipital, the back of the head. We'll talk about all of these. So for behind the eyes, a point that's often helpful. Again, there's other points that can be great. This is a point that's typically helpful. It's in that space between the 1st and 2nd metatarsal bone on the foot. There's a big hole in between those. And as you palpate in there, you'll find a tender spot. That's liver 3, great for vertex headaches, and also often for headaches behind the eyes, treating the occipital area. So it's right in the back of the eyes, you'll find all kinds of tenderness here with eye headaches. Works great to treat that area as well with the tigerthermy. For temple headaches, gallbladder 41, this one's between the 4th and 5th metatarsal. Again, there's a whole big gap between those bones. You palpate around in this area and you'll find a tender spot, and that will help clear pain and tenderness along the temples for headaches there. For frontal headaches, sinuses, you can just use the tigerthermy right in this local area, wherever it's tender. Feels great and helps remove congestion so the lymphatic system can drain more effectively. And also gallbladder 40, below the lateral or outside ankle bone or malleolus. It's below and slightly in front of that ankle bone. There's a deep depression there, almost always really tender if there's a sinus infection or a headache in the front. So great for treatment there. Feels wonderful to treat that with tigerthermy, finger pressure, all work well. For occipital headaches, we're looking at bladder 60, 66, and 67. For bladder 60, it's right behind or posterior to the topmost part of the ankle bone, before the Achilles tendon in that deep depression. 66 and 67 are kind of like stomach 44 and 45. In this case, you draw that line from the proximal border of the nail, The lateral border of the nail and the little toe where they meet is bladder 67. Palpate with your fingernail. You'll find a precise area that's tender. That's the spot you'll work. For bladder 66, you follow the little toe until you get to the knuckle. And right before you get to the knuckle, you'll feel where this bone expands to form this knuckle. And where that expands to form the knuckle, there's a little corner there. And at the border, or where the skin changes color or texture, that's where bladder 66 is located. Again, palpate around with the fingernail, find the tender spot. That's the point you'll be working. So helpful tools. The incense stick is helpful. Just a regular old incense stick works great. I think I'll be demonstrating these shortly. We'll talk about how to use a Tiger thermi warmer. We carry these at OHS. They're not expensive. They're hugely helpful. Just fingers using shiatsu. It's how we find the points anyway. Works great. And I'll talk about the neti pot. So for neti pot use, I'm going to stop sharing my screen here shortly. We'll talk about the neti pot, and we'll talk about these points. They're all recipes, but they're good ones. These used all the time in clinic. Obviously, there are other points as practitioners we would find, but you're going to get some good results from using these points in clinic. They're very helpful. And then, of course, palpation increases precision. So you're not going to mess up. Just play, palpate around, find the points that are tender. You're going to find this very helpful. So before I stop sharing my screen and go to the demo on these 4 strategies, if you need a Tiger Thermi, let us know. If you have further questions, let the office and your practitioner know. If you're seeing this during sequestration, during COVID-19, we do have a system to dispense herbs and supplements for acute and ongoing needs. That's been working really well. And so let us know. And we're, of course, online and doing phone consults as needed. And it's really been fun doing these. So we may end up doing others, and this will be up on the website as well. So I'm going to stop sharing, go back to my full screen. So I'm going to start with just an incense stick. It's the size of the ember that does the job. So you light the incense stick, you choke way up, and when you bring the incense stick close to the point, you want to be exactly over the point. It's not random. It's acupuncture, not random puncture. So bring it close but not touching, and your thumb and forefinger will make it really easy to have control. And you can bring it close, and you want a mild ouch, not more than that. That's all you need, a mild ouch about every 10 to 15 seconds. If it's 30 or 60 seconds between owies, this gets to take too long. It's kind of a hassle, and it doesn't work any better. If it's 2 seconds between owies, you run the risk of getting a first-degree burn over time because you don't allow the heat time to dissipate in the tissues, and that's inelegant. So what we want to do is have just close enough that you get an owie about every 10 to 15 seconds. That's the ideal. When you get your owie, pull the incense away, blow off the ash because it's an insulator. You want to know when you go back exactly how close to be, because after the first little mild owie or two, you're going to be right there. Exactly how far to be. 10 to 15 seconds, ow, blow off the owie, come back. You're going to want to do maybe 7 little owies each place. And if you do 7, you go, gosh, that feels a ton better. Can I do more? Sure. Do 15, do 20. As long as you're getting more impact, that's fine. There's no problem here. Now, talking about the Tiger Thermi Warmer. These are just brilliant little devices. If you get an ash that's developed, you can just knock that ash off like this. This is real moxa in here. You light the moxa, make sure it's going well. And once that's going, you put this lid over the top, and you need the ember to be in the window or it will go out very quickly. You'll have to keep track of having fingers on the back of this or it'll just fall off. So generally hold it like this with one finger holding this piece so it doesn't fall out. The tip warms up and you use the tip to massage points to work the posterior SCM. It feels great. So this thing is really good. It's great on the sinuses, really soothing. And if it's not warm enough, you just push with this index finger. So you bring the ember closer to the tip. If it's too warm, let it come back a little bit, or you can move the moxa further back. Or if it's burning up too far back, just move it a little bit further toward the front and then put this back. To put it out, just put it like this. The ember's not in the window. It's going to go out within seconds. You can place it down anywhere and it's safe. Neti pot. Neti pots are incredibly useful for sinus congestion. If you have pollen allergies, they're just incredibly helpful. If you do woodworking, you come in from the shop and you don't really feel like wearing your mask today in the wood shop, it'd be a really good idea to get some of the sawdust out of your sinuses. So filtered water, clean salt, like Himalayan salt or kosher salt work the best. Nice warm temperature, and you want just enough salt that you can just barely taste the salty taste in the water. Most people use the neti pot by putting it in one nostril and letting it drain out the other nostril. And that's legit to do. Then you do the other side. And when you finish, if you blow a little bit, not too hard, you don't want to blow things past the eustachian tube into the inner ear. But if you blow a little bit forcefully, the force of the water clears more pollen or debris or extra congestion, and that's more effective. The piece that people miss is that there's an important structure called the nasopharynx. And if you think about the air going back, where it turns 90 degrees to go down into the trachea, that's the nasopharynx. And it's hard for the immune system to get access to that tissue as effectively as it does some other tissues in the body. So this is a common place where infection hangs out or gets started. So if we can rinse this area with the saline from the from the neti pot, it's hugely helpful. So you take this, you have warm saline, you can just barely taste the salty flavor. And the secret here is that if this is not open, the water won't drain down there. So you can hear that there's resonance in my voice. And if I do this, it's sort of restricted, just choked off. And now there's resonance. And now there's not resonance, but now you can hear resonance. The trouble is, if you do this so that gravity will feed the water back, it's already choked off. So the trick is to lean back and tuck your chin. And if you lean back far enough, gravity will feed the water past the nasopharynx and you'll be able to rinse that area. I mean, imagine not being able to rinse a wound on your arm. I mean, you want to be able to rinse this area if it's inflamed and infected. There's a Master Hotaguchi in Japan did research on this and got wonderful results treating focal infections at the nasopharynx that were having systemic impacts. Really breakthrough research. So here's the trick. You put the neti pot here, you close one nostril with the other finger, you take a big breath, you lean back and tuck the chin, and then you, so that you're keeping it from going into the lung. It's not hard, you will naturally do this. And when you run out of air, you stop, spit the water that's in your mouth out, blow forcefully, spit the water out of your nose, and then do the other side. Obviously not something you do in public. This is kind of messy. The first few times you do it in the shower. But if you, for example, have pollen allergies and you haven't tried this, you have to. I mean, I can't tell you, the people that I've talked with that start using a neti pot swear by it, and as do I. So that's how you use the neti pot. So I hope this has been valuable. If you need to go back and look at other earlier aspects of the recording, if you look up these points online, you're welcome to do that. If there's any questions, let us know at OHS. And stay well. And stuff happens, so if you catch a cold or flu or have pollen allergies, this should be a big help in easing that process, speeding it along, and helping you feel better when you're in the midst of it at the same time. Thanks for watching. Be well. Bye-bye.